Good evening, everybody, and thank you for joining us here at New Teeth Now. I am so excited to get into the New Teeth Now process, and we will be discussing that with Dr. Kirkpatrick this evening. So New Teeth Now is a procedure for patients that need a new smile, for patients that have been in dentures for a very long time. You tired of taking them in and out? You're tired of not smiling in family photos? This webinar is for you because it's a whole restoration created by the doctors here at New Teeth Now. And shortly we will be talking with Dr. Kirkpatrick. Before we go ahead and do that, let's watch one of our patient testimonials. This is Barbara, and New Teeth Now changed her life forever.
I've tried to take care of my teeth. I've had root canals, I've had gum grafting, I've had the bone root, the root planing and things like that. And no matter what I did, I wasn't able to save my teeth. I was very close to getting the dentures. My mom had them, my dad had them. I was scared. I didn't want to be the crazy aunt who takes her teeth out at parties.
So when Barbara originally came to see me, she had multiple dental concerns, and she wanted to know if there was an option, using implants to replace and reconstruct her upper and lower jaws. Part of the New Teeth Now procedure, we have the ability to place zygomatic implants, which go into the cheekbone and allow patients to still get the procedure done in one day without bone grafting.
I woke up from the surgery. My husband was right there with me. I got to have a little ice cream, which was cool because it was cold and I could do it. And then I went home with a brand new smile that very same day when I saw one of the little girls that I had taught last year. When she saw me in the hallway, her eyes lit up and she came to me and she gave me a big hug. And she said, "Miss Barbara, your teeth are beautiful." She said, "Look at your pretty face." And that was like $1 million. You can't keep me out of the photos now. I took my first selfie ever in my life in the parking lot of Florida Dental Implants the day of the surgery. Give yourself permission to take care of the mother and the wife of the one you love so that you're here to watch them grow up. I can't think of anything that I will not be able to do.
I am personally dedicated to helping people overcome the challenges of periodontal disease, dentures, and missing teeth. At Florida Dental Implants, our team of over 50 specialists are committed to help you get your smile back all in one day.
So if you or anybody that you know is feeling like Barbara, then you need to call New Teeth Now. And at the end of the webinar, I will definitely let you guys know a telephone number to call in and talk to one of our New Teeth Now consultants. So introducing tonight, the one and only Dr. Kirkpatrick. How are you doing this evening?
Doing well, running crazy as always.
I know. So we watched a video about Barbara and saw how much you impacted her life. That's pretty common with this procedure, isn't it?
It is, and it's just a benefit that we as, I don't want to say like surgeons, but as caretakers, as helpers being a part of this practice, we get to see that all the time. And it is very cool. And it's often that we have patients like Barbara, which, it's just an advantage that we get to be a part of,
having
seeing
that
the
kind
transition
of impact.
And seeing the impact that it does take on these patients.
Well, let's talk a little bit about you and how you got into New Teeth Now, because this isn't an everyday procedure. You can't just walk into your dentist office and have New Teeth Now. So let's talk a little bit about like where you went to school, how you got into implants.
Sure. So, I'm originally from Kentucky and did a lot of my school at the University of Kentucky and then surgery at the University of Florida in Jacksonville. And just one of the procedures that we were taught there were these like zygomatic implants and traditional dental implants. And getting out and say it, when you're a resident, you're just worried about finishing and doing your best and answering the right questions. And, you don't really know what you're learning, how much that it can impact real patients.
Right.
Especially in private practice. And, being here and seeing the need that a procedure like New Teeth Now can offer patients, and this practice being very willing and in a good location too, that helps. Between two major cities, there's a lot of patients that need this help, and there's not a lot of providers that can offer it. So to be a part of that and, can affect and change a life like Barbara's, it's pretty special.
And I know that you are very sought for. I mean, you are, the one to go to for this sort of procedure. We get a lot of people come in requesting, on your behalf.
And I hope that is because of reputation and, not just me telling patients that this can happen, but by actually doing it to patients and them talking to their friends and family. And, people like Barbara spreading the news that, it's something that, it is a procedure that can help people who have been told by, even other oral surgeons or dentists that they can't have this, that they need dentures. And a lot of our patients, they're patients that they're not going to take the answer that you need a denture. They want implants, something fixed, that they can bite into an apple and go to eat with their family and friends and not worry about teeth popping out.
Right. Well, we're in 2018.
Yes.
This sort of procedure should be, something
It should.
to go
And,
to straight away. I agree.
A couple of the implant coordinators, they've heard me say this, but like George Washington had a denture.
Right.
It was wood, but it was a denture. And that's how, some people are still getting dentures and there's way better options.
Right, but they're not familiar with them, obviously.
Right.
So who would be a candidate for New Teeth Now?
Well, there's a broad category of patients that fit into this, this procedure. Anybody who has a mouthful of bad teeth, anybody who doesn't have teeth and have dentures that they're unhappy with, and that's pretty much everyone with a denture, because I've never met a patient that's truly happy with a denture. And then people, especially people that have been told that you don't have enough bone for implants. And we see that every day. I had a consult today, and the lady had good bone everywhere except in a couple areas. And she had been told, and she was worried, and she was kind of sitting on the edge of her seat while we were looking at the CT scan, just wondering, she just wanted to hear, do I have enough bone? Can you do this for me? And, I'm looking at her like, yeah, you've got great bone. But she had been told several times that she didn't.
Really?
And I'm sitting here telling her that it's actually very, very doable for her.
So not only is it a procedure that not many people have even heard of, but if they have heard of it, they've probably been told they're not a candidate.
Yes, that often happens.
And what is it that makes you able to give people with no bone or that have been told they cannot have dental implants? What gives you the ability to do it?
Well, I think experience is one thing, but having the ability to place, we have a special technique that we use with zygomatic implants. So we can bypass on people who don't have a lot of bone in the back part of the upper jaw, which is the most common area to be missing bone or not have enough. We can totally bypass that area, use the zygomatic implants, and the patient doesn't even need bone grafting or have to wait on a bone graft to heal.
So you mean to tell me that if somebody does need zygomatic implants, they can still come in the same day as somebody that doesn't need them and walk out the same day with teeth?
Yes, that's the beauty of the
That is
zygomatic
incredible.
implants. And I think a lot of people get told by their general dentist or another oral surgeon or another dental specialist that you're really not a candidate because they don't know about this. And it's a fairly new procedure, but it's not that new. It's got a lot of sound research behind it, very proven. It's a successful procedure, and we're trying to get the word out, because if your dental provider doesn't know that it's an option, then how are you as the patient going to know that it's an option for you?
No, I agree. And you do these procedures day in, day out. This is your specialty. This is what you do.
Yes. And it is becoming more and more. It really is something that we do every day.
Right, that's amazing. And I know that it's impacted a lot of lives. Since we're on the topic of zygomatic implants, let's see if we've got a video of maybe one of the patients that you've done. I think you did a young lady called Bethany.
Yes.
And why did she need zygomatic implants?
So Bethany is a special person, special patient.
Okay.
And she had some medical issues in her past that she was, congenital issues that caused her to lose her teeth at a very young age. So she had dentures, I think, at like 8 years old, which no one should have that. No kid should have to go through that. But when she lost her teeth that early, it just, the bone goes with it. So if you don't have your teeth, the bone starts to melt away. So you can imagine if at 8 years old, she's already starting to lose her bone. She had very little bone when we got to her. And, it was cool because she could come in. She's an out-of-state patient. She could come in, have it set up, have the procedure done in one day. So she came in the morning, had the procedure completed, and left that afternoon with teeth screwed in.
She was very, very shocked.
Yes,
I
and
do
I'm sure we'll
remember
get into it, further in the presentation, but there's 2 sets of teeth that are included with this.
Right.
A temporary set that we put the day of. They still look, feel very good. We try to make the temporaries as good as the natural. It's just a different, as good as the final. It's just a different material.
Okay.
And it's going to be very exciting because Bethany's getting hers soon. And she had a special request that we've never done. I was against, for the record, but she really wanted it, so we're going to try it.
I love it. I can't wait. Is it the vampire teeth?
She wanted fangs.
Yes. I love it. That's going to be interesting. So
Yeah.
Bethany Wilhelm is on YouTube. She does talk about her teeth and stuff. And actually, when she came in, we explained the procedure. And like Dr. Kirkpatrick said, you come in, you leave that day with teeth, but you do have to come back for checkups. So let's watch Bethany's video.
I had looked into dental implants before, but I had so much bone loss from having dentures that it just didn't look doable for me anymore. When I was 8, I got dentures, and it looked awful.
And the longer you have a denture, the more bone loss you have. And when you have a lot of bone loss in the back part of the upper jaw, you either have to go through extensive surgery with bone grafting, and you let that bone graft heal, or you can use zygomatic implants and kind of do everything in one day. We're able to put 4 across the front, and then the 2 zygomas in the upper jaw. And on the lower jaw, I typically do 4 implants for the entire bridge, but she had enough that we could squeeze in 6. It's a great feeling just knowing that in one day make that big of a difference in a patient's life. Our girl, we all want to see.
Okay. Wow.
They look good.
They look so great. I'd say there's definitely hope. If you think that you can't have dental implants, obviously you definitely can. Now, thanks to Dr. Kirkpatrick, I actually feel free to smile freely and I can eat whatever I want.
Wow, you can see that transformation immediately after surgery when you hand her to the mirror. You can tell she's even still a little bit numb when she's talking in the mirror, obviously. Because how painful is this sort of procedure?
Surprisingly, it's not it's nowhere near as painful as what patients expect.
Right.
We do give, pain medicine and tell you how to manage the pain, but for the most part, it's very common for patients to come back and tell us that, gosh, I was just expecting any time it was going to start hurting, and it never did. Of course, you're sore. We spent a few hours together. You're going to know that we met, but it's something that's not, considering the amount of work that we do. Patients that have wisdom teeth taken out do way worse pain-wise.
No way.
Than these patients. Oh yeah, absolutely.
So you prescribe them painkillers. How many would you say actually take them?
I think it's, from what we hear, patients give us feedback that they take one of the narcotics that night.
Okay.
Like the night of the procedure, and then they, just because they're expecting it to hurt, and then they just convert to Tylenol or Advil the next day.
Well, you could even tell in that video of Bethany, that was immediately after surgery.
Yeah,
once her teeth were placed.
Like 10 minutes after her teeth were in.
That is insane.
Yeah.
And she looked so different, and she just looked so happy.
She did look different and
So
is very
different.
happy. And her journey is very interesting too. If you guys know how to get around on YouTube and can find her, it's a pretty cool story to watch.
No, I agree, yeah.
Because she's documented basically everything, not just our procedure, but kind of her life in general.
She is. She's very humorous.
Yeah.
So let's have a little look at a model of what is in Bethany's mouth. Do we have a picture of that maybe that we can kind of show?
Yes. Ted, if you want to go to the screen. So this is essentially, it's like an artist's rendition of what the upper implant bridge looks like. And it's just showing 4 implants, but what I do is I always do 6 on the top.
Okay.
Or 99% of the time I do 6. And, you know, it just supports basically with these small titanium screws, fix and basically secure that bridge to the implants, which are, implants replace the roots of the teeth. And, you know, the cool thing about this is you do not need 1 implant per tooth, which could get to be very expensive.
Right.
So you can brace just like a regular dental bridge. So if you're missing a tooth and a dentist crowns, you know, a tooth on each side of the missing space, that's cemented on. This is the same concept, except it's screwed into implants.
And that is so brilliant. Look at that. There is no palate.
No, it is.
There is absolutely nothing on the roof of your mouth.
It's as close as you can get to getting your natural teeth back.
That's amazing.
So it is a very cool procedure. And, you know, I've got a ton of before and after pictures, which I don't think we need to get into all of these, because when you
This
see a
one's
story
good,
like
though. I like
Barbara and
this one.
Bethany,
Yeah.
we can talk about Willie. Willie is a very cool guy, and, you know, he came in with the story, he'd had problems with his teeth most of his life, and just never had, really didn't know what to do with them. And his family kind of urged him to come in and at least talk to us about if he was a candidate. So he did. And, you know, as soon as I saw him for the consult, I knew he and I were going to get along, and I knew that we were going to, I knew what the result was going to be. And it was hard for me to explain to him what I could see in 6 months. But I'm going to show you his before and after. And it's just, you know, he was a very happy, outgoing person.
Yeah.
On
You
the
can
left,
tell.
like
Yeah.
the before picture. And, you know, when he came back, he has matching hat and shirt every time, you know, different colors.
Yeah.
And he's smiling and he's telling everybody about it. He's talking to everybody in the theater. And, you know, it just, you can truly see how it did affect him and change his life.
And I love how he picked that bright white.
Oh, yeah.
He had to be the brightest of the bright. Now, they're not always that white, are they?
No, in the picture, you know, it's a little whited out on the picture, but, you know, one of the benefits of this is, well, our number 1 goal is to get you back to being healthy. And, you know, a benefit that comes along with that is they're all custom. So you get to pick the size, the shape, and the color of the teeth. So it's really not, you know, as with Bethany and her fangs,
Right.
we're not picking that. She wants that. So we're going to try to do that for her. But, you know, we've had patients that have gaps between their 2 front teeth and they want them on these. Or we have patients that most people want them like Willie's, you know, nice,
Right.
straight, perfect, you know, teeth.
I love
But you
it.
get a pick. They're your teeth.
So I do want to just recap, because you were talking about how we don't replace each individual root. Obviously that would, you know, get 1, pricey, and 2, just,
Yes.
I mean, the support would probably crumble, I'm assuming, if you had like an implant for each tooth. Is that possible?
Yes. Well, yeah, I mean, it would still be pretty strong and supportive.
Okay.
But, you know, when you can, if you think about when you can tie everything together, and Ted, I don't know if you can zoom in on this, but see, I'm making Ted work tonight, which is okay.
And this is an actual model of one
Yes,
of our
this
teeth.
is an actual model. Okay, so that, if you can imagine, this is the bridge, and you can see the 6 cylinders that where the implants, or this gets screwed to the implants. But, I mean, it looks really nice, very aesthetic looking, and, you know, if you think of it, it's one piece, so they're all connected. So when you chew here, it's, the force is getting evenly distributed across the arch. So
Right.
all 6 implants absorb the force, so that does make it significantly strong.
Well, I was just imagining a table with like 10 legs versus a table with 4. Obviously,
Right.
which one's going to be more sturdy? It would make more sense.
Yes, and that's one of the things that we do is which I do think it kind of separates us here at this practice, is we place, there's not like, oh, you know, you're 4 implants. It's, you get as many implants as you have bone that I
Right.
can space out. So I try to, my minimum is, in typical, most patients have enough bone for 6 implants on the top and 4 on the bottom. But if you have room for 7 on the top, you're getting 7. If you have room for 6 on the bottom, you're getting 6. I mean, I try to, my number one goal, and I tell patients this in the consult, I don't ever want to treat you again. You know, I want to see you for follow-ups and find out how well you're doing, but I do not want to have to take you to surgery because I didn't give you enough support and now you have an implant fail. Implants are really successful and the chance of them failing is very low, especially in our hands, because we give you support.
Perfect. So I do have a question in, what do you mean by accepting? Sorry.
That we're allowing questions throughout the
Oh,
presentation.
perfect.
Oh,
Yes,
questions.
definitely. We do have questions coming in.
Yes.
So if you would like to do that, you can do that through the webinar by typing your questions in through the chat box, or you can do it via Facebook and leave some comments. Tag people if you think that, you know, they might be a candidate. This isn't a procedure if you're missing 1 or 2 teeth. It's not a procedure if, you know, you just have 1 or 2 flaws with your teeth. This is something for patients that either have no teeth or need all of them removing, but it's definitely a solution.
Yes.
Yes. And you were talking about failure rates. Just out of curiosity, what is the failure rate of an implant?
So across the United States, implants are around 96% successful.
Wow.
So we are at or above that. And I think one of the reasons that we are a little bit above the national average of implants is because we do take the time to put in as much support as you can get. And the more support you have, you know, the stronger it's going to be.
Wow. So I see a question and it does say, why do we have to have 2 sets of teeth?
That is a good question. And that's one that I love it when patients kind of, they think about that for a minute, or they've been, you know, there's a couple other places that do a similar procedure, or they try to do a similar procedure that we do here. And they have one set of teeth. And it blows my mind because, I mean, I feel like that I'm fairly good at this, doing this procedure.
Do you think?
And, yeah,
I don't know. I
little,
mean,
you
how
know.
many patients have you done?
And a lot. And I'm not that good to give you one set of teeth, you know,
Right.
because your body is going to change. So most of the people that have this procedure done, if you have periodontal disease or decayed teeth, or even no teeth for that matter, you go through the surgery and your gums are going to swell a little bit, then they're going to shrink down. And that takes around 8 to 10 weeks to basically settle down to a really nice, healthy level. And that's the goal of the procedure, is we want to take you from swollen, red, inflamed, sometimes draining gums, which sounds gross,
Right.
but we
that's
can
true.
literally take somebody who has terrible periodontal disease and cure it in one day. But it takes a little time for the gums to truly heal because they're red and swollen. So as they shrink over the course of 8 to 10 months, if you think about the bridge, and Ted, you don't have to zoom in on this, or I'll just use my hands. So if this is your gum level, and it's really easy, if your gum level's here, the day of the surgery, the temporary bridge goes in and it goes up and just kisses the tissue. You know,
Okay.
butts up against the gum tissue. As you heal, the gums are going to shrink because they're going to become healthy. So they shrink a little bit. Well, the bridge can't move because it's totally dependent on implants. So if you think about your gums shrink, you get the little space. Well, we don't want you to have that space forever. So we
Right.
know your gums are going to shrink. And it's not a lot. You're not going to get this massive gap. I mean, it's just a little bit. But it's enough where we want to make sure that's perfected. So once the gums have settled down and the implants have totally healed to the bone, a restorative team makes the final set of teeth. And they're made to butt up against the tissue and close that space. And patients love that.
Yes.
So, you know, in my mind, to think about that you're going to have one set and you get them the day of surgery, you know, patients just, in general, I don't think they would be as happy as they are with or 2 sets.
I'm actually glad that we got that question, and I'm glad that you covered it, because obviously I was doing my own little bit of research and looking at some websites that do a similar procedure. I don't know the name of it. I want to say it's like a G4 or something.
Yeah,
It's
there's all
got a
kind of
different
cool ones.
name, but there was one where it's literally, okay, you get your teeth in the same day. And I was just doing a little bit of research, I was reading, and they did get their teeth the same day, but then there was an extra charge for those final teeth that you were
Yes.
talking about. So it's always good to definitely ask as many questions as possible and, you know, go in depth with them. I think different materials, and what's our final material made of?
That's another really good thing about the newer technology is the final bridge is zirconia. So it's one piece. It's actually milled from a computer in a true milling machine. And then we have our dental lab technicians, which are truly artists of their profession. And they basically stain it and paint it and glaze it and make it really nice and pretty to the color that you want.
So New Teeth now have gone above and beyond to hire people
Yes.
that are familiar with that sort of material.
And that is a very good point, because everything is made here. So we're not doing the surgery here and you go somewhere else to see a general dentist or restorative dentist, or we send your impressions to, you know, China to have made. Everything is made here from scratch. And we've got we're down one really important person in our lab, and I think he may be watching, so if he is, we'll give a true shout out to Mike. We hope you're doing well. But, you know, the people up there, people like Mike, who are truly take it to heart on how these things look when they come out of the lab. You know, and they have a part in the patient's lives as well, because they meet them.
Right.
You know, that's the other benefit of them. Like, you know, when Mike was here, he could come out and talk to you as the patient and not just see a picture or have a model of your mouth. He's actually looking at you, looking at your skin, looking at the shape of your face. And that's a big advantage when the person designing your smile on the foundation that I've given them
Right.
is putting it together to be able to see you. And he gets to see the final product, which is cool.
So it really does take an entire team.
Oh, absolutely.
Completely.
Yes.
Now, as far as the surgery goes, you are board certified. I want to touch on that because, again, when I was doing my research, there are a lot of dentists that are doing this, but they don't have the oral board certification. What is that, and why is that important?
Well, that is a way that we gauge our profession and hold everybody not accountable, but to a certain standard of care. So, you know, I'm board certified by our national organization, which is the American Board of Oral and Maxillofacial Surgery, and it's a very difficult written exam, and then once you pass that, they allow you to sit for your oral exam, which is very intimidating, but they cover everything.
Yeah.
And, you know, when you pass that, then you're board certified, and then you have to recertification is every 10 years, so you got to stay on top. The good thing about that, and that is very important, that you want, whether you come here to see me or you go somewhere else, make sure the person is board certified, because if they're not, then who knows if they're keeping up with the latest and greatest technology? Who knows if they truly know what they're doing? You know, it's just, if you're not board certified, then either you failed the boards or you never took the time to study for them.
That's kind of concerning.
Yes,
Yeah.
very.
And I would hope that after watching this webinar, nobody is going to go anywhere else
Right.
except for us.
And the other thing that you know that I would tell patients, I'm all about second opinions. You know, when you come to see me, if I'm the first person you've seen, then I'm probably going to tell you, you know what, hey, take the information that you got from me today about your exam and your CT scan and what I recommended for your treatment. Go get a second opinion, because the more informed you are as the patient, the better patient you're going to be for me. And that's whether you're doing research online, you know, you're talking to friends, but definitely second opinions. And I love being your second opinion. Like if you've gone somewhere else first and you come to me, you're mine. Like I know I've got you.
So talk to me a little bit about the consult, because you were talking about x-rays and CAT scans. So in our consult, we include that, correct? We do an
Yes.
x-ray of the mouth. And what kind of information does that provide for you?
An enormous amount of information. So, when you come for your consult, you'll meet with one of our implant coordinators. They'll take a CT scan of your face, and that shows us, and then I come in and, of course, do an exam, and we go over the CT together. So you're looking at the same screen that I'm looking at, and we basically plan your case with you. So when you leave, you sort of know how to read a CT of the face, and you know exactly where I plan on placing your implants. And one of the things that I do is to kind of grade myself. After every procedure, we take a post-op x-ray, and I've got the little yellow arrows on the screen that when I'm planning your case with you, and I'm showing you, everywhere you see an arrow, there's going to be an implant. And pretty much after, and we take the after scan, you overlay it, and there's an implant.
So you actually
They're
grade
that
yourself.
specific.
You grade.
Oh, no,
I'm going back to
absolutely.
you grading yourself.
Yes, I do.
Okay, so in the CT scan, you're going to plan where you want to put these implants, just visually. Then when you're in the
Yes.
operating room, you actually do it, and then afterwards you go back and
Check
you
it.
check it. I like it. It's
Yes.
very thorough.
Yes.
Yes. How often do you get an A+?
I don't really give myself a
You don't
letter
give you A+?
grade.
No?
It's either
Oh,
I
okay.
just tell the patient it looks like 2 thumbs up.
Like good?
Yes.
Okay.
Yes.
And then what are the post-op checkups like? How do they work?
So I think that post-op checks are one of the reasons that we do have a very high success rate. We don't just do the procedure and then kind of sweep you out the door and
Right.
good luck and call us if there's a problem. We really do get to know you, and it's not like you're here every day, but I see you about 10 days after for your first visit, and it's a very quick check. I'm looking to make sure that you're doing a good job keeping it clean and there's no infection. And if everything looks good then I see you about 3 weeks after that. If everything looks good then we put you on basically like a 7-week recall. And I see you just quick checks, make sure that everything looks good, you're doing a nice job keeping the gums clean, and we do that until we get to the 6-month mark. Once we hit that mark, you graduate. Cap and gown, full ceremony, you graduate, and we call it going to the penthouse. Where all the surgery's done, where the foundation and the follow-ups are laid, is down on the first floor. And then when you graduate to the penthouse, you go upstairs. And that's the restorative department where the lab and our restorative team is located, and that's where all kind of the really cool artistic part comes in.
So before they've graduated though, I'm sure that they've mentioned the changes that they're planning on making, like Bethany with her fang teeth
Yes.
and stuff like that, and then that's when that goes into action. That plan
Yeah,
goes
and
into
that's
action.
a very good point. That just on a side note, when the changes that you're going to make, so we try to make your temporary teeth perfect, just the way you want them to be on the final. But that's a luxury you have. One of our implant coordinators used to call it that's your test drive set. So you wear these temporary teeth for 6 months, and if there's something you don't like, or you're scared to go a little white on the teeth, or or too big teeth, or you want to change something, you've got that luxury. You can change anything, and it doesn't cost you anymore. It's just one of the benefits.
I'm glad you mentioned that, because what New Teeth now offers versus other places is everything is all inclusive.
Yes.
Literally from your post-op checkups. If you have 7 post-op checkups, or you just have 6, or you have maybe 9 because you want extra changes, there's no additional fees for that.
No.
It is as it is. And then also you're very flexible, because I know you've had out of state, out of country, people from my country in England have
Yes.
come to see you for this procedure. And you're quite flexible when it comes to the checkups. It just depends.
Yeah, and somebody like that comes from out of the country, for example, if you're doing a really, really good job keeping everything clean, and I'll tell you, I'm pretty straightforward with you, and I'll tell you what you need to do to stretch them out, to stretch out those appointments. And if your gums look pristine every time I see you, then maybe I don't have to see you every 7 weeks. Maybe we can really stretch that out, because we understand that you're traveling, and we're not going to make you, buy a plane ticket to come see us if we know everything is good. And we have phones here too, so
Right.
we call our patients and check and make sure that you're doing okay. And if you have a problem, you call us. And a lot of times, with the technology today, somebody thinks that there's an area that doesn't look right, or they're checking themselves in the mirror. They take a picture and text it or email it.
Right.
So we can. There's ways that we work with our patients,
No, definitely.
because we do try to make it easy.
And you do have several people from out of the country.
Yes.
You've treated so many, because this is not a procedure that is common for everyone. I want to look into the lab a little bit more. We have a video
Okay.
with Dr. Dibbs. He's one of our restorative
Yes.
dentists. We also have Dr. Nofala, who's your
Yes.
main guy, isn't he?
Yeah, they both
So they
are
both
very
work.
good. And Nafal and we've just been working together for a very long time.
I love Dr.
And,
Nofala.
Oh, he's
I love Dr.
very
Dibbs
good at what
too.
he does. Yeah,
Yeah.
yeah.
So let's take a look at one of the videos, and it'll just kind of explain the lab process to everybody.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. And we need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable. Not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Well, Donna is one of your very well-known patients. She had this procedure done how long ago now?
Oh gosh, it's been a few
been a
years,
while.
and she was a very big change.
Yeah.
That just, immediately, and you can tell it in her. It's cool to see Donna's transition.
Yeah.
How much it really did affect her life, and because she's super outgoing and very kind of, out there wanting to meet people and always talking to people, and just in life in general and her work and everything. And it's cool to see how much it improved her confidence.
Well, and her health.
Oh, and her health.
There's a
Definitely her
massive
health.
connection
Yeah.
between periodontal disease or the
Yes.
oral body connection. Don't we have a slide on that?
No, you're very good.
So intuitive.
Yeah. So, the oral body connection, you're right, Emily, there is a very big difference.
Oh my goodness.
Kind of how it can affect people like Donna, who, if you've had periodontal disease is, or some decayed teeth, periodontal disease is just a really low-grade chronic infection that can take its toll on the body. And, you know, if you go back to this slide, Ted, it's, you know, the mouth is the gateway to an awesome creation. So if you think about what keeps you alive, food, your mouth's the first thing that it encounters. Air, your mouth is basically the first thing that it encounters. So everything kind of has to pass through the mouth. And so if you got periodontal disease, which is just infection around the roots of the teeth that cause bone loss and swollen, inflamed gums, or if you're chewing your food in that, or your air that you're sucking into your lungs, past that, no doubt some of that bacteria gets taken down into the stomach with your food, taken into your lungs with a deep breath. And, you know, you can read all of these things that it can either make them worse or bring them on, which, like a heart attack, it increases your chance of heart attack, stroke. Women who, you know, are still thinking about having kids, it's just a low-grade chronic infection that can lead to a low preterm birth weight baby.
Wow.
I mean, that's significant. Diabetes, osteoporosis, the respiratory diseases. People have COPD. If you have bad periodontal disease, it can exacerbate like COPD. But what it comes down to is it's just a low-grade chronic infection. So it doesn't really matter if it's in your mouth or on your big toe or, you know, where the infection is. The longer your body's fighting it, it's just your immune system is basically just going and going and going, and it can shorten your life expectancy. So there's a big, you know, connection there. And to the point that, you know, now they're teaching, if anybody's been for a physical recently, you know, when you when you went to the doctor for a physical, they would, you know, take the popsicle stick and tell you to say and that was it. And it was like 7 seconds in the mouth and that's it. Now they're really looking at the status of your gums, your teeth, and if they see bleeding gums, swollen gums, red gums, you know, a lot of decayed teeth, they're going to really talk to you in part of the discussion, just like they do about, like, you need to quit smoking or, you know, decrease the amount of alcohol you intake. They're going to talk to you about, you really need to go see a dentist and get that addressed. And if it's not savable, if the teeth aren't savable, then you need to look at something like this, or, you know, just to get them out.
Right.
The best thing you can do is just get the teeth out, and that gets rid of the periodontal disease. And then we're here to help with replacing them, like with implants.
Periodontal disease is not reversible either. That's the hard thing.
Once it gets to a certain level, it's not. So if you've got, you know, kind of a mild case of periodontal disease or the beginning stages, it is possible to reverse it and keep your teeth and be back to normal health again. But once it gets to a certain point, it is, you know, we don't laugh about it, or we just say, like, some of these people that just go on and on and on, that they may maintain it for a little bit, but it never gets better. It just doesn't get worse, but it's never normal. It's just, I mean, it's almost like a watchful neglect. Like you're just watching it and you're waiting until it gets to the patient can't stand it, and then they need something done like this.
So if that sounds like you, or you know somebody suffering and going through that, please, please, please have them call in, book a consultation with Dr. Kirkpatrick. He can kind of decide, you know, is your periodontal gone too far, or is it mild? And he's very truthful, I promise you that. He's going to take a good look at your scan, he's going to really look at your teeth, and it's worth just getting that checked. You know, if you're concerned, and a smile impacts your whole life, I know that. You smile in pictures, it expresses your happiness. You know, that consultation is going to be massive, and there is a telephone number, 800-615-5838, and if we just show that slide really quick for us, you can go ahead and write that number down. It's at the bottom of the screen right there. We do have people on standby at the moment. They're only going to be here for another, I would say, 10 minutes. So definitely give them a call and book that consultation. We'll be going over prices shortly here to discuss if your periodontal or your, you know, if your teeth are in dire need and you do need the New Teeth Now procedure, we're going to help you through it. And you're coming to one of the best places. If you don't think so, like Dr. Kirkpatrick said, get a second opinion. You know, it's always worth it. the more information you have, the better you're going to feel when you make the decision to come to New Teeth Now. So
Yes.
you also do a lot of facial restoration. You're a maxillofacial surgeon.
Yes.
Do you get a lot of people come in and ask you, once they've got their teeth done, say, they're like, oh, well, I'm a little bit more confident now and I feel happy about myself, but I'd like this done, or I feel like my chin, or my nose.
Yes, there is. And that's, a very cool thing that patients can get here as well. And sometimes it can be done the same day of their surgery for this. And we can talk about that. So, like a total, almost like the, I think it was ABC's Extreme Makeover.
We need to go on ABC. And do that
you
show.
really can come in with a mouthful of bad teeth and have, all your teeth taken out, implants put in, new teeth on that same day. But while you're asleep, also have like your eyelids done, or, some other cosmetic wear like chin implants, cheek implants, submental liposuction, where we liposuction fat from the neck, and
Wow.
It's just kind of little additions that make a big difference in the overall appearance. And not everybody wants that or needs that, but it's a cool thing that we can offer.
And you do a lot of lasering as well, don't
yes,
you? You use
and the
laser
laser is a very good addition to this. And I think we've got some before and afters of some of those procedures. But before, there was some questions about like who's a candidate for this,
Okay.
for the New Teeth Now procedure. And it's kind of easy for us, but if you look, if you have no teeth or you're unhappy with your dentures,
Right.
then you're definitely a candidate for the New Teeth Now implant bridges. If you have a mouthful of bad teeth, you need to get those addressed, whether it's here with us or here, with someone else. That's a reason to get the procedure. Definitely, if you have severe periodontal disease, that's that infection that we were talking about. And this is my favorite. If you've ever been told that you don't have enough bone for implants, you need to come see me, because I've been here. This is now 11 years, a little over 11 years, which I can't believe that, but it is. And, I've yet to have a patient that didn't have enough bone for implants. And that, to me, says a lot about the techniques that we can use with the New Teeth Now.
Mm-hmm. Well, zygomatic implants are not a common practice. You were fortunate enough to, been doing them for how many years now? Since
Almost 16.
Insane, 16 years with zygomatic implants, an implant that not many people are even familiar with.
Right, and it's the recovery is pretty much the same. It's they're just a way to bypass deficiencies in bone to get a really solid, stable implant without grafting. And it's going into, one of my favorite things about it is it's anchoring into your native bone, not a grafted bone. So it's still a very strong, secure hold of the teeth.
And it must help that you have the, cosmetic background, so,
Yes.
to also be able to place these
So
and know
we
where
can-
they're going.
Right. So we're very, very familiar with all the anatomy in the areas, and, we know where we need to be and where we shouldn't be. There's some places the sun is not meant to shine,
Right.
and we know that.
So who is this lovely lady that had zygomatic implants?
So, yeah, Ted, so if you go to this. So this lady came to see me, and she's one that she had upper denture and a lower, if you look at these, she's got 2 implants on the lower jaw. And these were made for a denture that snapped on and off. She hated it. It was better than just a regular denture on the bottom, but it did not work very well. And she
I can
wanted
imagine
to,
pulling that on and off
Oh,
as
yeah.
well. Oof.
and she wanted to get rid of these, and she wanted teeth that did not come in and out. Well, she'd been to several other places, and if you look at her upper jaw, there's really no bone here. There's a little bit of gum, but that's her palate. So she has no ridge, which means no bone. So she came, and she was, kind of depressed in the consult, that just waiting for me to tell her, hey, thanks for coming in, but we can't really help you. You don't have enough bone. But she did. And that's her before and after. And that's screwed in teeth that do not come in and out. There's no wings that go up and underneath the cheeks or the lips. And there's nothing covering the palate.
Now tell me the truth. Did she have any of the procedures? Because that doesn't even look like the same person.
No, she did not. She just changed her hair.
See,
because
we
of her
can
teeth.
never be too sure with you. But that,
Right.
her whole facial feature just looks
Yeah,
uplifted.
it
like her
does.
whole,
And but I
everything.
think that one of the benefits of restoring your teeth and putting the implants where they should be, instead of just worrying about where you don't have enough bone, you're restoring the volume. So it does fill the face back out to a more, because when you lose teeth and you lose bone, you kind of cave in.
That's
this
what,
area here.
that's what it looked like.
And we restore that volume. So it does
Right.
make you look more youthful, for sure. You know, and if you look at this lady, another lady, she actually came down from the northeastern part of the U.S., and she had seen people all over up there that just could not help her because she didn't have enough bone in the back. But here are the zygomatic implants.
I like
And
that
it's something
picture.
that we do all the time. You know, she had good bone here for the front two implants, the side implants to support the kind of the middle part of the bridge. Here's where she didn't have enough bone. So we anchor these into the lower part of the cheekbone, bypasses the sinus. It's totally outside of the sinus. And, you know, it bypasses all this, because if you look really close, you can see all this gray stuff in between the implants. That's bone. That's great. Then here it just drops off. Can you see that?
Yeah.
Here it drops off. So you can imagine the bone goes from this thick to this thick. So that's not enough. So she's a patient that's looking at either sinus lift and bone graft procedures
Oh my goodness.
and letting it heal for 6 to 9 months, then trying to do implants, or do zygomatic implants in 1 day. And you can imagine what
Look at that transformation.
chose.
So she's never going to go through what your previous patient went through with that sunken in look. She's now forever got.
she's
Good
got
structure.
the fullness and maintained her structure. Yes.
That's brilliant. And that midline changed completely.
Yeah.
Like those teeth,
did, yeah.
they were way off.
We can magically move the teeth for sure.
So talk to me about your patients that come in and they do the whole thing. I'm really excited for you to tell me about that. So
Okay.
I feel like
So-
that's going to be me in the future. Like I just
It's
want the
gonna
whole
be a long time
makeover.
before you need anything like that. But we all do age.
Yes. Yeah. Never say never.
You can't stop Father Time, you know. So that's one thing you cannot buy.
Time.
Yes.
Tell me about it.
Okay, so the New Teeth Now Total Facial Makeover. Botox. You know, these are simple things that are very easy to do at the same time. Botox and fillers, injectable, the lip augmentations, chin and cheek implants, brow lifts, eyelid enhancement, facelifts, neck lifts make a big difference in appearance. And, you know, rhinoplasty is nasal surgery. The rhinoplasty I really don't do at the same time or recommend doing, because I don't want the patient to have any swelling or anything that would make it more difficult for me to see what I need to see.
Okay.
And you know, that's something that's pretty much the only one that I would not do at the same time. But everything else can be. And if you go back to the screen, you know, this lady that came in, and she came in initially to talk about the implant procedure. Had been told she didn't have enough bone for implants, and then she happened to see that that I did the cosmetics here, and she's like, well, I don't really like these dark spots, sun spots. She's a Florida girl. And, you know, age spots, sun spots, fine lines and wrinkles around the eyes and the mouth. You know, she wanted to know if we could improve these. So at the same day that we took all of her teeth out, put in new implants, new teeth, and this is 2 weeks after. So we did a CO2 laser resurfacing of her facial skin. And that's her result. You know, look, I mean,
That's just after a laser.
yes. And, you know, it didn't perfect the skin, but there is a huge, this looks like her younger sister.
Yeah.
You know, huge difference. Opened up her eyes, you know, got rid of the fine lines and wrinkles in the forehead and around the eyes and around the mouth.
Uh-huh.
And pretty much the sunspots, you know, dramatically improved.
Well,
So
even
that's a big difference.
under the eyes looks so much
it's
tighter.
refreshed. It is tighter.
I knew.
And the cool thing about the CO2 is you watch the skin tighten as you're doing it. I mean, it's immediate.
That's brilliant.
Facelift before and after. You know, she didn't like her neckline. Another facelift. You know, if you look really close, and what I hope you notice is none of these after pictures look like a plastic treated patient. And
No.
and that's not a negative. It's just in the past, especially in the 80s and 90s, people that had a facelift, they used to call it like the wind tunnel look, where they pull it so tight straight back that that's not what you do, and that's not how I was trained to do this. You want to keep patients looking very natural, but to lose about 20 years, 15, 20 years. So you reposition the muscle and the skin, the tissue underneath the skin, back to where it should be. She still looks appropriate, she doesn't.
Yeah.
But the neck, dramatic difference in the neck and the lower face and the cheek and the eyebrows. She had a brow lift, facelift, liposuction of the neck, and a neck lift. That this picture says it all to me. If you look at the nasolabial folds, the marionette lines here. Are you old enough to know who Howdy Doody is?
No.
So, he was like a dummy for a ventriloquist. So the mouth moves with the face stands still, and it has these. They're called marionette lines, and then the neck. She basically has no neck angle. It's just one from her chin all the way down to her chest. So that we liposuctioned and tightened. Now she has the true defined neck angle. I mean,
She's
that's a
taken
big
20
difference.
years off, look, or even more.
At least. CO2 laser before and after. Chin implant, a very simple procedure that can make a big difference. She's all these little dimples here. Those aren't dimples. It's just where she's trying to strain her muscle to close her lips. She couldn't do it. Now she doesn't have to do that. They're gone. So, to try to wrap this up, because I know we're getting at the end of the hour, but with dental implants, and I've had these questions. That's why I put that slide on there. But are they ever going to decay, or will my implants need a root canal? And I'm kind of looking, is it a trick question? But dental implants will never need a root canal. They're not going to decay. They're very easy to maintain. So you brush them, toothbrush, toothpaste, just like you do your natural teeth. And then, you've seen, especially Donna's before and after.
I know.
But we do, one of the things that we didn't really mention, you treat them like natural teeth. So you brush them with a toothbrush, toothpaste. And then every 6 months, just like you and I go get our teeth cleaned every 6 months, if you can't take whatever you're using for your teeth out and wash them soap and water under a sink, you have to get them professionally cleaned, because you're going to develop plaque and calculus, and you can't stop that. So you have to get it professionally cleaned. And that's just kind of, it's a good part of the process, because then somebody's at least looking at you every 6 months, and they know that you're staying healthy and your gums are healthy, and they're going to last you.
It just appeals to me so much, because then you don't have to go and get another cavity filled or a root canal. I mean, I'm tempted to do it. Just because, why not? Thank you, everybody, for joining us. Great questions. Thank you, Dr. Kirkpatrick.
Thank you.
For answering them. I don't think I could have answered them without you. You think?
Oh, it's a team. I mean, it's just like
easy.
the procedure. It's a team. You have to have the correct team.
Perfect.
And we've got a good one.
We do, definitely. So thank you again, and you have a great evening. Bye-bye now.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.